tumors of salivary gland. So, the most common tumor found in the older men is your Warthin tumor. Then the most common salivary gland tumor in your women is your pleomorphic adenoma. Then the most common benign tumor is again your pleomorphic adenoma, and then you have your most common malignant tumor, which is your mucoepidermoid carcinoma. So, now let us discuss a few important points regarding your pleomorphic adenoma and your Warthin's tumor. So, pleomorphic adenoma, it is your most common benign salivary gland tumor. It is much more common in women compared to men. The average age of your presentation is your 45 years, and it is most commonly seen in your parotid, which is your around 80% of the cases. Also, it may be seen in your submandibular gland and your hard palate. Now, these are usually your painless and well defined solitary mass. Now, the malignant transformation is suggested by your sudden increase in size and involvement of your facial nerve involvement, right. So, this too would be suggesting your malignant transformation. Now, the treatment is usually your surgical excision, including your normal tissue to include the pseudopods. Now, what happens if you end up doing an enucleation? Now, if you do an enucleation, what happens is that there will be a capsular breach. Hence, you need to do a surgical excision with your normal tissue to include your pseudopods. Now, in your HPE, you will find your mixed epithelial, myoepithelial and stromal elements, right, and the luminal cells express your CK7 and myoepithelial cells express P63, S100, SOX10 and SMA. So, this is one of your recent images that has been given in your Bailey and Love 20th edition, a double head or a large pleomorphic adenoma that has been grown over 15 years. So, as we had discussed, these are usually solitary swelling, painless swellings, right, and they are slow growing tumor. So, these were few of the important points with respect to your pleomorphic adenoma. Now, coming down to the Warthin's tumor. Now, this Warthin tumor, they are also known as your adenolymphoma or your cisadenoma lymphomatosum. These are your second most common salivary gland tumors. Now, they are composed of your oncocytic epithelial cells lining your ductal, papillary and cystic spaces, usually found in your older men, and they are associated with your radiation exposure and your cigarette smoking. Now, they are found exclusively in your parotid gland, especially at which side, that is your inferior pole, right. Now, they are also known to occur with the other salivary gland neoplasm. Now, they are also painless and a slow growing swelling. Now, facial palsy is rare in your Warthin's tumor. Malignant transformation is also rare, and the treatment would include your surgical excision of the tumor. Now, the histopathological would include your papillary and your cystic structures lined by your bilayered oncocytic epithelial cells in your lymphoid stroma with germinal centers. So, these are your important differentiating features in your histopathological compared to your pleomorphic adenoma, where you will find your oncocytic epithelial cells in your lymphoid stroma with germinal centers in your Warthin tumor. So, this was some of the important points of your benign neoplasms of your parotid of your salivary glands. Now, in the next video of the tumors, we shall limit our discussion to your malignant tumors. Thank you.